respiratory cell units. This brand new protocol we have lately heavily depends on you. Since our human enjoys the habit of smoking, it is possible that we will encounter a complication known as bronchitis. So, can you give a little bit more of an insight on this complication? I was just about to get to that. Bronchitis is a condition in which the airways in the lungs, called bronchial tubes, become inflamed and cause coughing, oftentimes with mucus. Gross. Indeed. We've had enough mucus incidences in this body. We don't need any more.
And what are the causes exactly?
Well, we have two types with slightly different causes. We have acute and chronic bronchitis. Our human, however, will be at the chronic bronchitis stage due to their long-term smoking habit.
Jeez, already? Why weren't we informed of the acute one?
Our security system was tight enough for the acute, but it seems as though it's gotten a little loose since we're headed towards the chronic stage of bronchitis.
Dang nabbit.
So for the acute bronchitis, this inflammation causes increased mucus production and other changes. Although there are several types of bronchitis, the most common are the acute and chronic. Acute bronchitis may also be called chest pain. Most symptoms of acute bronchitis last up to 2 weeks. The cough can last up to 8 weeks in some people. As per chronic, this one is more serious. It keeps coming back and doesn't go away at all. It's one of the conditions that makes up what's called chronic obstructive pulmonary disease or the COPD. It fills the airways with thick mucus. The small airs that normally have phlegm out of the lungs are damaged. That makes the human cough. As the disease goes on, it's harder for human to breathe.
Exactly. Now, next discussion. The causes of bronchitis. An acute bronchitis can be caused by viral invasion, bacterial infection, and exposure to irritants such as tobacco smoke, dust, fumes, vapors, and air pollution. As per chronic bronchitis, it is the long-term exposure to air pollution, dust, and fumes from the environment, along with genetic factors, repeated episodes of acute bronchitis, and/or the history of respiratory disease or gastroesophageal reflux diseases.
Is there a chance for our human to have increased risk?
Of course. The risk increases if our human has allergies and/or asthma, or have been inhaling smoke or secondhand smoke, and/or have experienced a viral or bacterial invasion previously.
Question: who exactly will be targeted in this complication?
The bronchial staff are the main victims for this, so it is up to your units to make sure that they're completely safe before...
Too late for that.
Guess your security system isn't as tight as you thought it would be.
You're messing with the wrong cells here, buddy. Alright, Jane. What seems to be the problem?
Doc.
Yes, that's me.
I've been coughing for the past couple of months now, and I even have some phlegm. I've been taking regular cough medicine, but it isn't going away.
I see. You're looking a little blue there, too. What else have you been experiencing?
Well, I feel fatigued sometimes, and I've noticed that I've been wheezing too. I've also encountered that my breathing shortened a bit, and then my body temperature goes up once in a while, and that I get chills.
What else?
Well, my chest hurts. My throat also feels sore. I kind of have a runny and stuffy nose too.
Do you have any habits you think would contribute to the signs and symptoms?
I smoke.
And how long have you been smoking?
Since I don't remember, but it's been a long time now.
Well then, let me get you into some tests to figure out what's going on in your chest then.
Macrophage, glad you're here. Take a look at this.
Have you gotten the location of the invaders?
Yes, the chest x-ray determines if there's pneumonia or another condition. It's especially important if the patient is or was a smoker. Take a look. They're mostly within the vicinity of the lungs.
Good job. Now we need the sputum traces and the pulmonary function results.
Macrophage, we're glad that you came.
Do you have the sputum analysis?
Of course. The sputum test is used to see if there's an illness that can be helped with antibiotics. Can also be used to test for signs of allergies.
The sputum is a bit of an off-white, yellow, and sort of green-like color. Definitely indicates that you're bronchitis invaders.
And take a look at this pulmonary function result we got from the spirometer for the pulmonary function test.
Doesn't that measure the amount of air the human can hold and how quickly the air can come out?
Yes.
I need to inform the rest. Thanks for the results.
Good luck to your units. There's too many of them. We need backup.
Macrophage is on it. Just hang on some more.
Alright, so let me explain some treatments and management for your bronchitis here. Let's start with the therapies. We have 3 types of therapy options: protussive, antitussive, and antibiotic therapy. To explain it further, the protussive therapy is indicated when coughing should be encouraged. The antitussive therapy is indicated if coughing is creating a significant discomfort and if suppressing the body's protective mechanism for airway clearance would not delay healing. Yeah, just like that. Drugs such as dextromethorphan, codeine, and benzonatate are simply to suppress coughs. However, for your chronic state, we'll have to get a tad bit advanced. The goal for this type is to relieve the symptoms and prevent the progression of your complication.
So... What does that mean?
Well, here are the options. Bronchodilators, which could work for acute bronchitis as well, steroid medications, vaccines, oxygen therapy, surgery, and or pulmonary rehab.
Wait, what?
Bronchodilator medications may help to relieve symptoms of chronic bronchitis by relaxing and opening the airway passages in the lungs. Steroids are inhaled as an aerosol spray. Steroids can help relieve symptoms of chronic bronchitis. However, it may cause side effects such as weakened bones, high blood pressure, diabetes, and cataract. Patients with chronic bronchitis should receive a flu shot annually and pneumonia shot every 5 to 7 years to prevent infections through their vaccines. Oxygen therapy is suggested as the patient's disease progresses. They may find it difficult to breathe on their own and require supplemental oxygen.
What about the surgery?
Lung volume reduction surgery, curing which small wedges of damaged lung tissue are removed, may be recommended for some patients with chronic bronchitis.
Oh, the rehab sounds a lot more friendly.
Yeah, here's a prescription for your bronchodilator. Let's give that a shot for a while. It's coming.
Prepare your mask! Bronchodilator incoming!
Well, my coughing is going down a tad bit. Wonder if I could still get my dental treatment today.
Well, hello there, Jean. What can I do for you today?
Just a checkup. Or at least I don't want anything too serious to happen to me today.
Is there anything I need to know before I get you seated?
Well, I was diagnosed with chronic bronchitis a few weeks ago.
And how are you feeling right now?
A little cough here and there, but not as bad as the first few weeks.
That's great to hear.
What? But What does my bronchitis have to do with dental-related things? Isn't it just affecting my lungs?
Well, patients with bronchitis should be seated in a semi-supine position, meaning they are seated almost upright. Appointments are also kept short to decrease your stress levels. Now let's get you in and check you out. Fingers crossed! Have you been taking medications via inhalation?
Uh-huh.
Well, no wonder your mouth seems so dry. I suggest not to use it for too long though, as it can cause gingival and periodontal disease, as well as cause oral thrush. I'll be using a rubber dam on you in the future appointments, so I'll be needing to modify it so you can breathe easy. I also have to be wary when using powdered materials as to not cause your condition to worsen.
Thanks, Doc.
So let's end this case report, shall we?
Alright, let's do this!
A 65-year-old male patient has a chief complaint of shortness of breath and coughing with sputum for 1 year.
For the patient's history, well, the patient was asymptomatic for around 2 years, and then he gradually developed cough sputum, breathlessness, and weakness all over the body. The patient did allopathic treatment, but the results weren't satisfactory. They had no history of hypertension, diabetes, hypothyroidism, or tuberculosis.
Upon physical examination, blood pressure was 130/70 mm mercury, pulse rate was 78 beats per minute, respiratory rate was 16 breaths per minute, temperature was normal, there was no pylori or lymphadenopathy, and clubbing was absent.
For the diagnostics, auscultation on the lungs shows that wheezing is present, and on the FEV1 or the forced expiratory volume test shows that there is a result of 1.45 liters, where the normal range is less than or equal to 1.76 liters. And the FVC or forced vital capacity gave a result of 1.72 liters with a normal range of less than or equal to 2.37 liters. As for the treatment, nebulization therapy for 1 month, and after the whole course of treatment showed signs of improvement as a result.
That's all for today. Thanks for watching. Let's all remember to keep each other safe. Bye!